Coming up next is Dr. Kimberly Taylor. Here's your chance to talk about what matters to you. Although you will receive helpful advice from Dr. Taylor, remember, this is not to be construed as a form of psychotherapy, diagnosis, or treatment, and cannot replace a therapeutic relationship with a mental health professional. You can reach Dr. Taylor by calling 564-1290 or toll free at 866-564-1290. You can also listen live on the internet at drkimtaylorshow.com. So here now is Dr. Kimberly Taylor.
Welcome to the program. It's great to be with you again, and I really hope that you had a good week. If something has troubled you, though, and you want to talk about it, I'm here for the next hour, ready to take your calls. We all know that life can be stressful and confusing at times, and that's why I'm going to be here every Thursday afternoon to help you sort through your issues so together we can find some answers that will work for you. Today, I want to begin by talking about sleeping disorders. So, how did you sleep last night? Did you have trouble getting to sleep? Do you tend to look at the clock around 2 or 3 in the morning and struggle to fall back to sleep? Do you have a hard time waking up? Or do you struggle to stay awake during the day? All of these may be signs that you have a sleeping disorder, and you are not alone in that because more people are suffering from lack of sleep than ever before. According to the Centers for Disease Control and Prevention, nearly a third of all adult Americans are in fact sleep deprived. Think about that. That's a whopping third of us walking around needing a nap. So, today, what I want to do is I want to help us out, and I'm pleased to welcome Dr. Winifred Lender to the program to talk with us about sleep issues and how we can develop healthy sleeping patterns and how to recognize and treat sleep disorders. So if you have questions about how to get a good night's sleep, or if you know someone who has problems sleeping, give us a call at 564-1290 or toll free at 866-564-1290. You can also email us your questions at drkim@drkimtaylorshow.com. We will be right back after the break. I'm Kimberly Taylor, and you're listening to KZSB AM 1290.
You are listening to Dr. Kimberly Taylor. You can reach her by calling 564-1290 or toll free at 866-564-1290.
So let's get started here. I am pleased to welcome Dr. Winifred Lender. She's a licensed psychologist in private practice in Santa Barbara, and she specializes in sleep disorders, and she provides therapy for clients of all ages with various presenting concerns, including sleep issues, anxiety, and mild depression. She did her undergraduate work at Cornell University and received her master's and doctorate degrees at the University of Pennsylvania. So welcome.
Thank you for having me.
We spend about a third of our life sleeping. So what do we know about what is the purpose of sleep?
Well, it's a very interesting question, and it's a question that researchers have pondered for quite some time. And right now, there's no total consensus about why we sleep. There's different theories. Mm-hmm. One theory says that sleeping helps us consolidate learning and memories. And in sleep, we are able to consolidate this information. And when we wake up, oftentimes we can remember things better. For example, if you were studying for an exam or reading an article right before you went to bed, oftentimes you may find after a good night's sleep, it's crystal clear. You make that connection. Another theory says that we sleep to restore our body. Makes a lot of sense. Mm-hmm. And there's some evidence that suggests when we look at different neurons in our brain that certain ones are firing that sort of help us restore our body and make us feel fresh in the morning. Mm-hmm. So that's another theory. Then a final theory says that we need to sleep basically to save calories, that we're so active during the day. We need some time where our body is resting to gear us up and give us the caloric energy we need for the next day. That's the third hypothesis.
So with that, what is the average amount of sleep that we actually need? And does it vary by age, by sex? And I guess part of the question is, how would we know if we're getting enough sleep?
Very good question. Basically, there's no one-size-fits-all when it comes to sleep. Everybody has their own specific sleep needs, and it does differ based on one's age, also one's activity level, and also generally the amount of stress one is under. Overall, what we find is that most adults need somewhere between 6.5 to 7.5 hours to function at their best. What that means, though, is there are some people that can function very well with less sleep and some that will need a lot more sleep. What it comes down to is really knowing yourself and knowing how you feel best. A way to test if you're getting enough sleep is to, for example, on a weekend, not to set your alarm clock, to go to bed at the same time you would on a typical weekday night, and look at what time you wake up naturally. So if you did that on a Saturday and Sunday, and you woke up within 45 minutes or an hour of your typical alarm clock, you'd be getting the sense that overall, you're probably getting enough sleep. If you're finding that without that alarm clock, you're sleeping in 3 hours or more, it's probably a good indication that you are not getting enough sleep and that you have a sleep debt. Now, certain populations need more sleep. So, for example, we all know that infants and young children need more sleep. The elderly actually need pretty much as much sleep as middle-aged adults, but their sleep is a little more fragmented. So although they may seem to wake up very early and take naps, overall they have the same sleep need that middle-aged adults have. Another part of the population that has significant sleep need is teenagers. And the interesting thing about teenagers is a lot of people say, oh, those lazy teenagers, they never want to get in bed and then they always sleep in the morning. Well, actually, teenagers need a good amount of sleep, more than adults, and we're estimating somewhere between 8 and 9.5 hours. But what happens is they tend to get sleepier later in the evening. So adults tend to get a signal, their body temperature tends to drop, and about 7:30, 8 o'clock, they get a sense that they're getting a little sleepy. It's time to start getting ready to get to bed. Teenagers, this happens later in the night, and it can happen from an hour and a half to 2 hours later. So they're not getting the signal sometimes till 10 o'clock at night that they're getting drowsy and they need to start the process of going to bed. And that's why they tend to like to sleep in, because they're actually getting sleepier later.
And it shows that that's probably why they're sleeping in their first classes in the morning.
Exactly.
Because school starts too early for them.
It does. And that's an important point, that the way the school system's set up really does not work well for the biological clock and sleep cycle of teens.
Okay. What are the common sleep problems? Because people can wake up and think that they slept well, but they might not know that they've woken through the night or are snoring through the night, and that they're not getting that deep kind of sleep that they need. So what are the common problems?
Well, one of the most common problems is sleep apnea. And what sleep apnea really refers to is the lack of breathing that happens periodically throughout the night. And in sleep apnea, what's happening is the airway becomes restricted. So it is very difficult to breathe. And people who have sleep apnea typically engage in very loud snoring that's punctuated, could be every 10 minutes, every 12 minutes by ceasing in snoring, ceasing in breathing. And they fight to breathe, and then a few seconds later, they're able to breathe, and what allows them to breathe again is they tend to undergo a partial awakening. So they may not be aware of the fact that they're waking up every 10 to 12 minutes, but they're having to do that to breathe. So that if you have a partner, if you listen to somebody who's snoring, and the snoring is loud, and then all of a sudden it ceases for a few seconds and then returns, that would be a good sign that this person should be evaluated for sleep apnea. Now, what happens with sleep apnea is, if you can imagine, throughout the night, there are all these cycles where you are undergoing a partial awakening to reset your breathing. You are not getting a very restful night of sleep. You're also having difficulty entering into deep sleep and REM sleep because you're constantly awakening yourself to breathe. So you may not be aware that you're doing this, but in the morning time when you wake up, you will not feel well rested.
You're tired.
You are tired. You
And
may
tired
suffer
throughout the day.
Exactly. You may suffer from drowsiness throughout the day. You also may experience dry mouth when you wake up, but you may not realize. You may look at your watch and say, "My goodness, I was in that bed sleeping for 10 hours." But in fact, it wasn't good quality sleep. And sleep apnea is estimated overall that about 30 million Americans suffer from sleep apnea.
Is it more male or female?
It is more male. 24% of the male population have some evidence of sleep apnea, from mild to severe, and only about 9% of the female population evidence sleep apnea. And it does tend to be more prevalent in obese populations. So obesity is correlated with it, and it makes sense if you think about the constriction of the airway. If there's more fatty tissue in there, it would be easier for that airway to become constricted. It's also associated with a certain type of airway structure and certain type of neck size. So other things predicted as well.
Okay. And what are some of the other common sleep disorders?
Another very common one is insomnia. And I think when you hear the word insomnia, it just affects people. You know, some people immediately get tense when they hear that, or their eyes start to droop and they start to get tired. But basically what insomnia is difficulty falling asleep and difficulty staying asleep. And the difficulty is present even though there's adequate time to sleep. And what happens is this difficulty presents at least 3 times a week for a month. And if that criteria is met, then the person has insomnia. There's also intermittent insomnia, which can happen if a person has some difficulty sleeping some nights, but it may be 1 or 2 nights, and it may be for less than a month.
Okay. All right. What are some of the other ones? I know there's a list of them. So
Yes,
let's
there's
just
a
go
huge.
through
There's
them.
actually 80 of them, so we
There's
won't go.
80. Okay,
we won't
so
go through
just,
all of
just
them.
the most common ones.
Well, other common ones are what we could talk about is nightmares, sleepwalking. And what happens in these are that oftentimes people can initiate sleep fine, but then in the middle of sleep, oftentimes during a REM cycle, they begin to act out what's happening in their dream. So, for example, in sleepwalking, they would be having a dream and they would start acting it out oftentimes. Or their ability to move, which is typically immobilized during sleep, does not function appropriately, and they begin to walk around. With nightmares and also night terrors in children, there can be very frightening situations that can happen for some people very often, some people less often, but they tend to be associated with being overtired often, being stressed, and having a sleep debt. In addition to the ones we've discussed, there's also narcolepsy. And what narcolepsy refers to is really the inappropriate sleeping throughout the day. So people who are narcoleptic will just be in a conversation like you and I are, and all of a sudden I could glance over to you and you would be asleep at your station over there. And what happens is people do not go through the typical stages of sleep where they start getting drowsy and move to deeper and deeper sleep. They just automatically, like a light switch, end up in a very deep state of sleep. But conversely, the sleep is not very restorative. And even at night, when they try to go to sleep, it's not a very restorative type of sleep cycle. Other issues that can impact on sleep are issues like teeth grinding, bruxism, which happens. There's also restless leg syndrome, which can really impair one's ability to initiate sleep.
Okay, so it sounds like it is key to our health to really get a good night's sleep. So let's take a break here, and we'll come right back with the how-tos on how to actually develop those good sleeping patterns. Thanks. I'm Kimberly Taylor, and you're listening to KZSB AM 1290.
You are listening to Dr. Kimberly Taylor. You can reach her by calling 564-1290 or toll-free at 866-564-1290.
I'm here with Dr. Winifred Lender, and she is a specialist in sleep disorders. She works with people of all ages, correct?
Yes, that's correct.
Okay. We actually have a call coming in, and I think that we'll go to the call next and see what's going on with her. So we're on the phone with Lori. Welcome to the program, Lori.
Thank you.
What's going on for you today?
Well, I've had this problem for probably about 27 years, since my youngest was born. And I don't have a problem falling asleep. It's a problem staying asleep. And I've developed a pattern that sort of works for me, but it probably doesn't, that when I wake up, if I'm in the middle of reading a good book or something, I'll pick the book up and read it until I fall asleep. And if I'm not reading a book, I will actually get out of bed and go watch TV till I'm tired.
Mm-hmm.
The problem is I'm an early riser, always have been. So if I go to bed at 11, wake up at 1, and I'm up till 3, then I wake up at 5. And so I get up and I have my coffee and I go exercise. And sometimes by 10 in the morning, I'm so tired I can barely move.
You probably
and
need a nap.
I do function throughout the day, but I just never feel like I have enough sleep.
Okay, so you said that you haven't slept well for 27 years, and how old are you now?
58.
Okay, so this is a perfect question for our expert here.
Mm-hmm. Well, thank you, Lori, for sharing your sleep experiences. They are not unusual, and what we do find is that women do tend to have more issues with insomnia, which is what you're describing. And what you've talked about, Lori, is that you can initiate sleep well on your own, which is very positive. But then you find that you are waking up and unable to fall back to sleep in a normal amount of time. And it sounds like you described that sometimes it could be about 2 hours or so before you feel sleepy again?
Mm-hmm.
Okay. And you indicated that sometimes you're reading, sometimes you're leaving the room to watch TV, and that's important that you're not having a television on in your bedroom. Is that correct?
Yeah, I don't have one in my bedroom.
Okay. So that's a positive thing. And then you said you'll feel sleepy and you'll come back to bed and then sleep until 5 o'clock and then you're wide awake again. Is that correct?
Mm-hmm.
Okay. Well, what you've described, as I said, is common. And what I would recommend you look at is that period of time when you wake up. One thing to first think about is to think about having tools at your side that will help you fall back to sleep and relax you. So I like the idea of a book. I think sometimes when we think about books that are exciting, that we're really interested in. And I would recommend that you find a book that may not be that interesting, Lori. Sorry about that.
But it's boring.
But something that's a little dull or boring that might not excite you or pull you in that much. And I think that's something that during the day when you have some energy, you find things that you could stack up on your bedside table so that they are ready. And what I'd recommend you do is that you try doing that instead of something that's more stimulating. If you find that after about 20 or 25 minutes of reading the dull, boring, you're still alert, then that might be a time to go into a different room to do some TV if you needed to. But the idea would also be with the television to turn on something that's not very stimulating, to turn on something that you might not be that interested in, and to keep the lighting as low as possible. So those are just some subtle changes, but they could pay off and make a big difference. The other thing I'd recommend you think about too is if there are other strategies you could use within the bedroom setting. So for example, if you could develop some kind of story or relaxation script during the day, that's something that you might try even before you pick up the book. So you'd still be in bed, but something that you could use that wouldn't require bright lights or require noise. That would be something else to consider.
Mm-hmm. Could it be also that after all of these years that she's just in the habit of waking, and it's going to take a while to break that habit, but if she does and takes some of these tips and works them on a consistent basis and just keeps at it, that soon it will change and she will create a new habit?
Well, it's a good point. Sleep is very habitual. So I think Lori has developed these patterns, and biologically her body is waking her up. So part of what she can do is to try to decrease that by not stimulating herself so much when she has that natural awakening. And to know that it takes some time to change any kind of sleep pattern. It takes about 10 to 14 days. And clearly this sleep pattern has been in effect for a very long time. So it may take even longer. And then on the other end, I know, Lori, I heard you say that, you really like to get up and you like to go early. But another thing to try would be just to give yourself, if you feel 5 o'clock is when you're raring to go, maybe each week, just say, I'm not going to get out of bed till 5:10 and then not till 5:20, because even if you're not sleeping, if you're having that restful time in bed, that can help get you through the day. And those are some things to consider. And then also just be aware of napping. We didn't discuss napping. Are you napping, Lori, during the day?
No, I'm just petrified that if I nap, I won't sleep even. I'll sleep even less.
Okay. Well, that's important. Napping can interfere with the overall sleep. It doesn't sound like you're doing that. But what would be important is to, try these different strategies we talked about, and to keep in mind that it will take some time. But the last thing you really want to do is to be stimulating yourself by anything that's going to be exciting in a book, or lots of lights or lots of noise stimulation. So that would be something to consider. And then to also try to give yourself a little more time on the other end, even though your biological clock is waking you up, to get you a little more used to the routine of spending a little more time in bed, because it makes it a very long day if you jump out so early.
Yeah, it does.
It does.
Okay.
It does.
So,
well, thank you very much.
Yeah, it sounds like some good tips. Thanks for the call, Lori.
Thank you.
So we know that chronic lack of sleep can certainly lead to poor job performance. It can lead to weight gain, depression, anxiety. So help us. I mean, what can we do, and what are some of the tips that we can use?
Well, one of the most important tips is to set yourself up on a sleep-wake cycle that's fairly consistent during the week and during the weekend. So the idea being that the difference between the time you go to sleep and you wake up and the week and the weekend should not be a huge difference. It should be fairly similar. Within 45 minutes to an hour of the time you go to sleep and you wake up should be the same during the week and during the weekend. And that's because if there's too large a difference or a gap, you almost get a jet lag effect. So if you go to bed very late on a Saturday night and wake up at 11 or 12 on a Sunday morning, it's going to be very hard to reset your clock to go to bed at 9 o'clock like you need to wake up for your job on Monday at 6 a.m. So that's the most important thing to look at and to evaluate. It's also very important when you're thinking about sleep to look at your caffeine intake and your alcohol intake. And you want to be limiting caffeine in the evening. And if you're having sleep issues, you really should not have any caffeine from lunchtime on. With alcohol, you should know that even though alcohol does tend to relax people and make them feel drowsy and sleepy, it does not help you sustain sleep. So if you've been having alcohol with dinner before bed and you're having sleep issues, you should minimize that. Also important when you look at your bedroom, you want your bedroom to be dark and to be cool. That's conducive to sleep. And overall, it's thought somewhere between 65 degrees to 72 degrees is optimal for sleep. It'll feel a little cool, but you can put blankets on, and that helps to signal the body to decrease the temperature to go into sleep.
And if you can't keep your room dark, do the eye masks work
It's a
just
very
as
good
well?
point. Yes, eye masks can work very well too. And earplugs. You want to keep it relatively quiet as well. So if you sleep with someone who's a snorer or there are any disturbing sounds, consider the earplugs. Again, all these things are changes that you may not be used to, but you can get used to them and they can become routine. Something else very important is to really limit digital activity before bed. Now, computers and other digital devices emit this blue light that sort of signals our brain to be on and to be paying attention. And that does not bode well for a good night of relaxing sleep. So you really want to look at what you're doing right before bed. If you can ban those objects from the bedroom, all the better. If they have to be in the bedroom, make sure that the light is not emitted, so you're turning your cell phone down or whatever it is, closing the computer. And really trying to gear down 45 minutes or an hour before bed, doing things that are relaxing, that are not digital. Developing your own routine for sleep is very important. That can involve things like a warm shower, that can involve listening to music, whatever it is that you enjoy. You also want to be limiting your intake of liquids and foods before bed. And you don't want to go to bed thirsty or hungry, but you also don't want to go to bed very full, because as your stomach starts digesting, that's something that can kind of keep you awake or make you uncomfortable as you try to initiate sleep.
Okay. So all of these things also are things that will work with the kids too, because I know when my child was young, I had this whole routine set up that about an hour and a half before I wanted her to go to bed, I would take her for a walk, then she'd have a bath, then she'd eat, then it'd be stories, and then bedtime. And it worked really well because it did settle her down and get her used to that this is a time that we change from being active to going to sleep. So some of the things that you're saying now are things that parents can also do for their children.
Yes, all these things can be done for children. And as parents, I think one of the greatest gifts you can really give your children is providing with them with that structure and that routine to learn positive sleep habits. And we do learn a lot of our sleep habits when we're young. So if parents can institute these good sleep habits in the home, the children will really benefit from them.
Parents too.
Parents too, exactly. The whole family. And a child's behavior is really affected by the amount of sleep they get. They can learn better, they can be less impulsive, they can be more attentive, and their mood improves. So there's definitely a payoff for everybody in the household for focusing on developing that routine. At first, it takes more effort and time, but children especially really appreciate when they know the expectation and they have the structure. And instead of racing around and being anxious that there's 10 minutes until it's bedtime, everybody has to get to bed, just hearing that voice of that parent saying it's time,
Increases the anxiety.
does not relax.
The purpose, right.
Exactly. So it's very good to be cognizant of that. And if you have a child that's having sleep issues, I would really examine the things we were just talking about. What is your sleep routine in the home? What kind of behaviors are the parents modeling? What's the routine for the child? And you want to be calm and present, but have structure and routine.
Okay, so that we really are learning that there is more to be done than just counting sheep.
Yes, that's a great analogy.
So we'll be right back to go through some more of the tips and also know when to seek help. I'm Kimberly Taylor, and you're listening to KZSB AM 1290.
You are listening to Dr. Kimberly Taylor. You can reach her by calling 564-1290 or toll free at 866-564-1290.
With me now is Dr. Winifred Lender, and we're talking about sleep. We actually live in a culture where people are really encouraged to think of sleep as a luxury, and that it is something that we can easily cut back on, and that they even pride themselves on saying that they only need a few hours sleep. And after all, isn't that what caffeine is for, is to jolt us back to life each day? But so how do we go about encouraging people to really look at their sleep patterns, to educate them about how important sleep is?
Well, I think it's very important that you, as a person and people who are within families, evaluate what their family belief is about sleep. And it is very true that in our culture, we undervalue sleep. I think we often feel a little bit like Margaret Thatcher, who once said sleep is for wimps. The idea that we really don't need that much sleep, that we can just marshal through.
Was that Thatcher or was it Martha Stewart?
Well, could be both of them. Could be both of them, right?
Uh-huh.
But the whole idea is basically since the electric light bulb was introduced, there's been this race to get more and more done during the day.
And be more and more productive.
Exactly. Be more and more productive and to discount the importance of sleep. So fundamentally, everybody really needs to look within themselves and determine what their beliefs are about sleep. You may have some beliefs deep down inside, which, say that, I do feel like a wimp because I need sleep, or only weak people need sleep. Whatever it is, they may be very dysfunctional thoughts, but you should try to make yourself aware of what they are and really work towards replacing them with more functional types of thoughts. You should think about sleep as one of the single most important behaviors that you can engage in to support your overall physical health and your mental health. Besides eating and drinking, sleep is really essential to all of us. And it's important that you remind yourself of that, and you also remind your family, your children of that. So that's the first step, really evaluating what your beliefs are about sleep and changing them in your mind. Now, to be able to change them, you may need to educate yourself more.
Okay, and you spoke to me about some apps that could be used, too, in this process. And this might be good for kids also?
Yes.
Okay, what kind of apps are out there?
So in terms of apps that are out there, there's a whole wealth of different apps. And if you go and you just would type in the search engine best apps, sleep apps for 2013, you will get a huge slew of a list of them. Now, some of them focus on that initiating of sleep. So there are products that have all different ways to initiate sleep. There's some that work with meditation, some that help you develop relaxing image scripts, some that have all different kinds of sounds to help you soothe yourself to sleep. Some are specifically for children, some are for adults. In terms of maintaining the sleep, there are other apps that allow you to really chronicle your sleep, and they can, with their cameras, assess your movement throughout the night and can give you a printout of your sleep cycle, how deep it is. It could give you some idea of why you're not feeling rested in the morning. It's also important because people who have trouble sleeping, specifically insomniacs, tend to underestimate the amount of sleep they actually get and overestimate the amount of time they're up. So this can be helpful for some people in really giving them a clear picture and not a distorted picture of what's going on. So I think apps can help you with the process and educate you about your own sleep. Also, the National Sleep Foundation is a great resource. They have a website, and they have all different kinds of information about sleep, little tests to see if you're getting enough sleep. And that's another good resource for people to look at.
Okay, and so what does the treatment for a sleep disorder look like, and how long does that take?
Well, treatment starts by assessing what's really going on. And if you think you are having a sleep issue, the first thing you should do is monitor your sleep. And you can do that very simply if you go on the web and you put in the search engine sleep diary. You can print out a sleep diary. And for 2 weeks, you can very specifically look at your sleep, when you're getting into bed, when you're falling asleep, when you're waking up. Also chart your caffeine intake, your exercise, and your alcohol. So you will develop really good data to take with you to determine what the next step is. When you look at that data, if you are still feeling like there's a sleep issue, what you could do is you could go to your primary care physician with your sleep data and talk to them about a next step. If there's some concern about sleep apnea, for example, they might recommend that you go and do a sleep study. And in the sleep study, they would actually be able to evaluate if you are suffering from sleep apnea, and you'd be sleeping in a special location for the whole night, and you would get a lot of rich data, and they would talk about whether you were a candidate for treatment for sleep apnea. If there's no indication that you have sleep apnea or restless leg syndrome or something like that, then the default may be that you have insomnia. And the treatment for insomnia that is most effective is cognitive behavioral therapy. And what that focuses on is evaluating and rectifying the cognitions that make it hard for you to initiate and maintain sleep, as well as the behaviors that make it difficult for you to initiate and maintain the sleep. And people that do that kind of treatment could be psychiatrists, could be psychologists, and could be sleep specialists. But if you walk in with your sleep data, you're already sort of a step ahead to get started.
Okay. And how long does the treatment last? Is it short-term, brief, or can it go on for a lengthy period of time?
Well, treatment for insomnia has been documented to be effective, and most effective treatments can last from about 6 to 10 weeks. The important thing to keep in mind, like when we spoke to Lori earlier, is that sleep problems develop over a long period of time, years and years, and become very routine and habitual. So it does take some time to change them, and it also takes some effort. When you go in for treatment, the professional may ask you to do things that you don't like to do. They may say, I want you to stay in bed longer in the morning, even though that doesn't feel good to you. Or I don't want you to turn on the TV, for example. But the end goal, which could be more restorative, better quality sleep, really would outweigh, hopefully, those initial concerns about things, being asked to do things that just don't feel right initially.
Right, but for all of them, if they're having problems, that they do need to create the change. So these are some of the steps that they certainly can take.
Exactly.
Is there anything wrong with taking sleeping pills to help you sleep?
That's an excellent question. Very good question. Right now, we have lots of over-the-counter medications that people believe help them sleep, like Benadryl, for example. And then we also have medications that doctors prescribe that can help you fall asleep, some antidepressants and other medications as well. The important things to know about medication that's specifically designed to help you fall asleep was they were developed for short-term issues with sleeping, short-term insomnia, not chronic insomnia. And most of them are only supposed to be used for 2 weeks or 4 weeks. And yet people are using them for much longer periods of time.
Years.
Months or years.
Yes.
And what happens is the effectiveness wears off, so they get to be less effective because our body habituates to it. And then we tend to need more of the medication to get the same effect. And then eventually there's a tolerance where we just don't seem to get the effect from the medication.
So that, in fact, some of the sleep problems can actually come back at that point in time.
There is a rebound effect that if you stop the medication or you developed a tolerance for it, your sleep issues would come back. The other very important thing is that when you're using medication to help with sleep, you are not really addressing the underlying issue. So it's really just a Band-Aid that you are sleeping, but you're really not developing any better cognitions or behavioral patterns that will maintain that better sleep once the medication is stopped.
Okay, so really better to try and get to the root of the problem.
It is much better to get to the root of the problem,
So
yes.
what about some of the more natural products and or even warm milk? Does a warm milk work?
I would say that whatever you think could work is worthwhile. And what that really is
Well, Mom always said
yes,
warm milk
we
would
know
work.
Mom. We know Mom knows best. But really what you're speaking to is a self-fulfilling prophecy. If you believe something might help you and there's nothing that's dangerous about it or contraindicated, then you should try it. And again, part of what happens with sleep disorders is we feel a loss of control. We feel that we have no control over our sleep, and that leads to a lot of the anxiety and confusion. So if you identify things that you think can help you, I would suggest that you give it a try, as long as you're monitoring it on your sleep diary. If you're indicating warm milk, warm milk, warm milk, then you can go back and say, look, isn't that interesting? Those nights where I had the warm milk, I feel like I was able to fall asleep more quickly. So that monitoring can be very essential. I think it's also very important to realize that we all naturally have issues when we have trouble falling asleep. There are stressors, and it's very natural and even adaptive to have some trouble falling asleep because we try to process the information. The difference is that once those stressors are gone, if we continue to have issues falling asleep and then we become anxious about falling asleep, that's when this normal difficulty sleeping due to a stressor moves into the realm of a sleep disorder. So it's important to be aware of that differentiation.
Okay. And how would you help people if they were just too wired to go to sleep? That their mind is just, still racing, they can't slow it down. What are some of the steps that they can take?
Well, what they would need to do is look carefully at their daily schedule. And they'd want to make sure that they were getting some exercise in the day that wasn't too close to going to bed. I would also prescribe for them a time of constructive worry. So that would be a specific time of the day they set aside, and all the issues that may be racing through their head right before bed, they write down, they address, and they do a sort of task analysis of how they're going to address them the next day, and that gets put away. I'd also suggest that they really invest in a relaxing bedtime ritual that we talked about, getting rid of those digital devices, shutting off the TV, doing things that might relax them, like a warm bath, or as your mother said, some warm milk, all of those kinds of things. And then instead of just trying to shut off their mind, think about what their mind could be doing that would be relaxing to them. Develop a relaxing script that they practice during the day that they say at night, listening to music on an app, or just opening the window and listening to it outside. All of those things that can really be relaxing and give their mind something to do.
Okay, so I have one more question about naps. There's nothing I like better than like a 15-minute power nap in the middle of the day. Is that helpful?
Yes, short naps, and that's key, what you said, 15 to 20 minutes. We call that a power nap, can be very helpful. And it's just some people like it, some people don't. But if it's something that makes you feel better, it can be very effective as long as it's not too close to going to bed in the evening.
Okay. All right. Well, I certainly want to thank you for coming here. I think there's probably a lot of questions. I would love to have you back someday because we have some more emails that have come in. We just haven't been able to get to those. So we are going to go to the break right now, but thank you for being with us, and I'll be right back. I'm Kimberly Taylor, and you're listening to KZSB AM 1290. So we're at the end of our program, and I really want to thank Dr. Winifred Lender for joining me. It has really helped us to sort out our sleep issues, and I'm sure that with consistent use of some of these methods that you have talked about, that it is possible to get a good, natural night's sleep. And so here's hoping that everybody out there can really get their Z's. Where can they reach you if they would like to contact you? What's the best number?
My phone number is 805-880-9699, and I'll provide you with some information to put on your website.
Okay, great. Because they can also, if they don't have a pen and paper right now, they can go to my website and get all of that info, plus the numbers and all of the
and
content.
some of the resources.
And some of the resources, yes. Okay. And my website, again, is at drkimtaylorshow.com. So I would love to hear from you, and I welcome your comments about how you feel about the show is going, and any questions that you may have. You can email me at drkim@drkimshow.com. And you can also listen to our program through live streaming on the internet by going to drkimshow.com. These shows can be heard again on the rebroadcast. Those are Thursdays at 10 p.m. and Sundays at noon. And if you want to listen to any of the past shows, you can find them on my website. And if you couldn't call in today, but if you do have some questions, that this coming Sunday I will be taking calls. You can check out my website for the information on that. And again, go to drkimtaylorshow.com. As we close, I want to thank Sandy Jacoy, my screener. She is the one that you will hear when you call in. And, of course, Richard Dugan. He's our engineer behind the scenes here. So I want to thank both of them for the help. And you can join me again next week. It's Thursday afternoons between 2 and 3 p.m., and I look forward to your company and to hearing from you about what's going on in your life. Meanwhile, have a great week, and let me leave you with this thought. Nobody else has to change in order for you to get better. And here's the kicker. When you make the change, everyone else will have to change in reaction to your change. Think about it. So until next week, take care.